Welcome to another short from the Vet Med Digest. Today, we dive into the vital topic of parathyroid function and calcium balance in dogs. Calcium homeostasis is essential for life, and the biologically active fraction, ionized calcium, is precisely regulated by key organs like the bone and kidney, governed primarily by parathyroid hormone and the active vitamin D metabolite, calcitriol. When this balance fails, diseases like primary hyperparathyroidism emerge. This endocrine disorder, frequently caused by an autonomous parathyroid adenoma, results in persistently high or high normal parathyroid hormone despite high calcium levels. This disease typically affects older dogs, with case haunts being highly overrepresented. Often, the hypercalcemia is discovered incidentally during routine testing, as many dogs show vague signs like increased drinking and urination, or no clinical signs at all. It is important to remember that while this is a critical cause, malignancy is the most common overall cause of high calcium in dogs. Treatment for the primary disease is often curative. Traditional parathyroidectomy via bilateral neck exploration has a high cure rate, around 95%. However, minimally invasive parathyroidectomy techniques are also highly effective, achieving cure rates similar to surgery while potentially reducing the risk of postoperative complications. The major risk after successful treatment is a drop in blood calcium, or hypocalcemia, because the remaining healthy parathyroid tissue has been suppressed by the chronic disease. Proactive supplementation with calcitriol is preferred due to its rapid onset to manage this risk. We must also consider the secondary form of this disorder. Elevated parathyroid hormone is an inevitable consequence of chronic kidney disease, known as renal secondary hyperparathyroidism. As kidney function declines, phosphate retention and decreased calcitriol production lead to excessive parathyroid hormone secretion. This excess hormone acts as a toxic factor, implicated in central nervous system depression, muscle weakness, loss of appetite, and worsening kidney damage. Controlling phosphorus is essential to management. Calcitriol therapy, when carefully managed, helps suppress the hormone's production and has been linked to improved well-being, better appetite, and longer survival in patients with chronic kidney disease. While a newer synthetic vitamin D analog, paracalcitol, can also lower the parathyroid hormone concentration, it still caused high calcium levels in many treated dogs, emphasizing the need for intensive monitoring with any such therapy. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.